Good morning. My name's Rhiannon Lester. I am currently recording for GNSG 6700 with Dr. Deb. This is infographic that I created. Unfortunately, this is something that we're very definitely seeing in urgent care, and this is actually where I'm intending to work in my practice. So I think this is going to be great because it will go for what I currently do now, and I can actually use this at work and in my future practice. But we're seeing reoccurrence of measles or rubiola, and this is what we should be looking for as practitioners and what we do based on what we're finding. So, measles is one of the most contagious diseases. Our vaccine provides best protection. We'll talk a little bit about rates of vaccination and how, unfortunately, those are actually declining. Isolated and isolating infected patients is going to be important for 4 days after the development of a rash, and then following airborne precautions to stop the spread. Reporting suspected measles cases to the local health department and laboratory confirmation to make sure that we actually have what we think we have there. So the symptoms usually a fever with malaise, the three C's, cough, corrosea, and conjunctivitis, and then pathogenomic anathema or Koplik spot. So it's like this maculopapular rash. Um, the rash usually appears about 14 days after the person's exposed and then spreads from the head to the trunk. I have further pictures to kind of show how does this disease spread? Through direct contact and infectious droplets, airborne spread when the infected person coughs or sneezes. The measles virus can remain infectious in the air for up to 2 hours after infected person leaves the area, so it is very highly contagious. Measles is one of the most contagious of all infectious diseases. Up to 9 out of 10 susceptible people with close contact with a measles patients will develop measles. So yes, this is a very concerning statistic that we need to be aware of. How do we confirm that somebody actually has measles? You can see this rash that we're talking about on the right. But there's measles-specific IgM antibody in serum, so from blood. But you can do the measles RNA by RT-PCR in a respiratory specimen, usually by a nasopharyngeal swab. But the idea is the more specimens you collect, you want to make sure that you are getting the best sample possible to make sure that you are actually detecting it if it is there. Unfortunately, because it is viral in nature, there's no actual treatment. It's just symptom support. So that way the body can take care of it. So people are thinking that this isn't important because, oh, it's a virus, it's self-limiting type of thing. No, there are actually complications that we need to be concerned about. Common complications for measles include otitis media, bronchopneumonia, laryngeotracheal bronchitis, and diarrhea. So that doesn't sound like, oh, that horrible of a thing, but 1 out of 1,000 measles cases will develop acute encephalitis, which often results in permanent brain damage. And if that's something that we can prevent, why wouldn't we? 1 out of 3 of every 1,000 children will become infected with measles will die from respiratory and neurological complications. There's also seizure risk with measles, and it's actually pretty common that after a measles infection that seizures can develop. Measles cases per million in 2019 were 140% higher than in 2010. And this is really sad, and it's really due to vaccination rates declining. So these are all things that we need to be aware of and educating our patients on the importance of vaccination to prevent easily preventable diseases. These are my references. Thank you for watching.